Good morning everyone. Today I'll be discussing about the topic apexogenesis and apexification. These both topics are very important in pediatric dentistry and are associated with opening at the root apex. One is done in a vital tooth and other is done in a non-vital tooth. Now let's discuss each of this topic in detail. First, apexogenesis. Apex means base, genesis means growth, that is, growth of the apex. So it is defined as the treatment of a vital pulp by capping or pulpotomy in order to permit continued growth of the root and closure of the root apex. That is, proper growth of the apex by different treatment, for example, direct pulp capping, indirect pulp capping, or pulpotomy. So in this, it is very important to maintain the integrity of the radicular pulp so that the proper growth of the apex should take place. So indication when to do this procedure. We can do this in traumatized tooth, pulpily involved vital permanent teeth when root apex is incompletely formed, no history of spontaneous pain, no sensitivity on percussion, no hemorrhage, normal radiographic appearance. Contraindication: when to avoid this procedure. In case of necrotic pulp, purulent drainage, history of prolonged pain, periapical radiolucency. Whenever such cases are present, we need to avoid apexogenesis. This is not the treatment option. Procedure: whenever this process are taking place, application of rubber dam is very important to maintain isolation, following by that of local anesthesia. Remove all of various tooth structure and open up the pulp chamber. Remove coronal pulp tissue and maintain the radicular pulp so that the integrity should be maintained for the proper formation of the root apex. Rinse all the residual debris and control hemorrhage by placement of a moist cotton pallet over the amputated pulp. Calcium hydroxide mixture is placed and followed by temporary. Follow-up radiographs are taken periodically to check the root development every 3 months. Once the root development is done, then we'll continue with that of the conventional root canal treatment. So in this case, you can see traumatic tooth, and in this, that is placement of the calcium hydroxide is done. After placement of the calcium hydroxide, patient is recalled after 3 months and the apex is checked, that is followed by the temporary restoration, and then again the patient is recalled after 18 months and there is a formation of the apex is seen at the base. Now, apexification. So, apex means base and fixation is to create or to fix the apex. So, it is defined as it is a method of inducing apical closure by formation of a mineralized tissue in the apical region of a non-vital permanent tooth with an incompletely formed root apex. In these cases, we will try to form the root apex. So we'll induce some material in the canal, and with that a formation of a barrier is seen at the apex. So the apex is not formed by itself. We will form the apex. Indication: non-vital permanent teeth with open apex then blunderbuss canal. In these cases, we can't do the root canal with an open apex. So in these cases, we need to do the closure of the apex by following the procedure of apexification using the following material, that is zinc oxide eugenol paste, tricalcium phosphate, collagen calcium phosphate gel, calcium hydroxide, mineral trioxide aggregate. And contraindication, that is in case of very short root, marginal periodontal breakdown or vital pulp. In these cases, we will not go for apexification. Now we'll start the procedure. First, we'll place the rubber dam and anesthesia will be given. Remove the entire pulp tissue from the canal. Proper irrigation should be done using saline and then working length is determined. Canal is dried with paper point. Then place the material such as calcium hydroxide or MTA in the canal. Recall the patient after 3 months and after 3 months check if it is symptomatic or asymptomatic. If symptomatic, repeat the procedure by cleaning the canal and again keep the material and repeat the entire procedure. Place temporary restoration. Recall patient after 3 to 6 months. By taking an IOPA, check if there is a root closure. After 6 to 24 months, if root development is complete, then root canal is done. And how to check the root closure? That is, we can check by paper point or by file also. For example, in the first figure as it is shown that the apex or end of the tooth is infected and is having an open apex. So in this case the apex is the canal is completely clean and the medicament are placed and slowly the root closure is seen in this case. So this is again a case of a traumatic tooth in which in the first it is seen the traumatic tooth and the working length is determined. After the working length is determined, calcium hydroxide is placed in this, that is after 1 month, and patient is recalled. And this is after picture showing after 6 months a little amount of barrier formation are taking place. After 11 months, little more took place, and up till 12 months the proper barrier formation took place and we can go for a proper root canal treatment. So this is the process for apexification. Thank you for watching this video.